It's a segment where we try to separate the fact from the fiction that's out there. And certainly there are a lot of questions and a lot of rumors out there when it comes to COVID-19, specifically about how the disease plays out, but also about the vaccines that we expect to be available perhaps by the end of the year. We are joined by infectious disease doctor from the Long School of Medicine at UT Health San Antonio, Dr. Ruth Berggren. Dr. Berggren, always a pleasure to have you on. What are you hearing about these vaccines that you're either excited about or that you have some trepidation about?
I would say we all should have a little trepidation, but my excitement is overtaking my trepidation at this moment. As I look at what's happening around the country and the scores of new cases and the deaths that are happening, we need a way out, and the vaccine is the way out. And I believe in the vaccine science. So we heard this morning that San Antonio's medical community and first responder community will have access to the Pfizer vaccine. We think we're going to get a shipment around sometime next week. And we have committees that are assigned to determine exactly who is at the highest risk and in the front row of taking care of COVID patients. And those people will be getting the vaccine first. And then other people who have less close proximity to patients who are sick with COVID will be getting the vaccine after that. And this is how the Vaccine Advisory Committee has come down in advising the whole country that healthcare professionals and frontline workers in healthcare should get the vaccine, along with people who live in nursing homes, long-term care facilities. They are also in the first tier of who needs to be vaccinated.
I think one of the big concerns when it comes to the vaccine is the speed with which this was developed, because when we were early on in this process, there was a lot of conversation just letting the general public know that, hey, this can take a decade in some cases. It has in the past. So is there any reason that how quickly these were developed should be a cause for concern?
Well, here's what I take comfort in. We have multiple different kinds of committees and panels that are looking over the process and reviewing the primary data. And even after the CDC and the FDA and the Vaccine Advisory Committee has looked this over, we even have panels like here at the UT Health Science Center of vaccine scientists who are looking at the data and reviewing it in order to make determinations about how safe this is. As that process goes forward, I am feeling increasingly confident that if there are serious safety concerns, they will get flagged for us. There are very many different kinds of experts who belong to different organizations that are taking a look at this safety data.
What do you say? I mean, obviously there are polls that we've seen, and there's anecdotal evidence that people may be concerned about taking this. Certain parts of our population may be concerned about getting a dose of this vaccine. What do you say to somebody about that, and how important is education about these vaccines in this entire process?
Well, I think everyone ought to ask questions. I think that's totally appropriate. And I think everyone should try to become as well informed about the vaccine process and how your vaccine works as they possibly can. And I think one of the issues that's come up about these earliest vaccines that are coming to us, the Pfizer vaccine and the Moderna vaccine, both of which are mRNA, people seem to be nervous that this mRNA is going to somehow get into your cells, DNA, and alter your genes for the rest of your life. And we need to have people understand that this messenger RNA doesn't even go into the nucleus of your cell. It stays way the heck away from your DNA. It's going to look for these protein-making machines that we call ribosomes. You can think of them like 3D printers. So the mRNA is just a code. It's a message. It goes to find the 3D printer that's in your cell, not even near your nucleus, not near your DNA. It tells the ribosome what to make, and then that piece of mRNA gets degraded by your cell and it's not there anymore. So that anxiety that people have that this is genetic material that's going to alter their own genes, they shouldn't worry about it once they understand what's actually happening on the cellular level.
We don't mind the dog chiming in, by the way. At this point in 2020, it's happened to all of us.
Exactly.
Right?
We know you're at home.
We've all
appreciate
been
your
there.
time. Yeah.
We're in the middle of a surge right now. We're seeing the numbers increase. 1,500 cases reported today, or yesterday rather, 760 today. So what's your advice for people who come down with COVID to try to keep them out of the hospital? What can they do at home to make sure that their illness doesn't reach that level?
So first off, I want to say we've noticed a number of people who wait and wait and wait until they get super sick before they even get tested. I say this from having been on the COVID consult service for a week. Just came off of that service at University Hospital yesterday. And so it's not a good idea to wait until you're desperately ill to get the test, because as soon as you are found to be positive, there may be treatments that you are eligible for that don't even require hospitalization. So starting on Monday, we've been able to have access in our community to the Regeneron antibodies and an antibody called bamlanivimab made by Lilly. And these are medicines that are given intravenously that can help people who have COVID that is moderate, not severe enough to go to the hospital, but moderate. And what we have found, what we've seen from the data, are that those people have their hospitalization or their emergency room visit then prevented in a significant number of cases. So if you're somebody who has COVID symptoms, and let's say that you are over the age of 64, or let's say that you have a high body mass index, you're very overweight. Let's say that you have kidney disease. Let's say that you are immunocompromised. You are somebody that's at high risk for having a bad outcome. Well, you are somebody that we want to help stay out of the hospital. And so your primary care doctor can make a phone call or send an email and refer you to a regional infusion center, which is down at the Freeman Coliseum. And there are trained, sophisticated personnel there ready to receive you and to administer this treatment. It will take about 3 hours, and that will give you a reduced risk of having to go to the hospital or go to the emergency room. So this is an advance. People need to know that it's there, and they need to know that it's a reason why you shouldn't defer getting your test if you're having symptoms.
Good advice. We're going to take a quick break. We'll be right back with Dr. Ruth Berggren. Back with infectious disease doctor Ruth Berggren from UT Health San Antonio. Doctor, we got a viewer question that I found intriguing. Because the Pfizer vaccine particularly is kept at such super cold temperatures, does it have to be brought back to room temperature when you give it? Is it given at that temperature? And if it is given at that temperature, does it feel cold? Is it cold going in when you actually get the dose?
Great question. So it turns out that it actually gets thawed to a certain degree and then refrigerated, and it can remain refrigerated for a number of days before it's administered. So you won't be getting it directly from the -70, -80 freezer. And I can answer from a secondhand experience anyway. My daughter is participating in the Pfizer vaccine trial, and she did not notice any such cold feelings when she got her vaccine.
Another question that I got was about what happens after someone gets COVID-19 and they recover. Let's say that they test positive, they recover, they may even get a secondary negative test. Are they then essentially free to move about? Should they feel comfortable, going over and being with friends or family they haven't seen? Is there any immunity? I think that's especially important as we're seeing more people get this in our community.
So I have to issue a note of caution about that. If you had true COVID and you truly recovered, you most likely have antibodies and you most likely have a degree of protection, but that comes with caution because we have seen a few cases, including locally, of people who clearly got reinfected more than 90 days after they had their original infection. And we at this point have no test that tells us if somebody is protected or not, and we have no way to predict who's going to be the person who gets COVID twice. So we can tell that person who has recovered from COVID that they are likely to be somewhat protected, but they should continue to be cautious. And as long as the community positivity rate remains high, as long as the hospitals are remaining full, that person should behave no differently than anybody else in terms of wearing the mask, keeping the 6-foot distance, and washing the hands.
Better safe than sorry in so many ways. Dr. Ruth Berggren, UT Health San Antonio, always appreciate your time.
Happy to be with you.
We'll be right back.